Yeah, just a quick review of Dr. Arthritis open finger compression gloves. So these are made specifically for people that have hand arthritis and have symptoms like pain and stiffness, although there are people using these for other things as well. So they work to do this in two ways. Number one, they provide compression, and that helps decrease swelling. So less swelling, it'll move your fingers around better, and you have less pain. The other thing it does is these provide warmth, which we know heat always helps arthritic symptoms. So a few points about these particular gloves. They do have an open finger design, which I really like. So if you want to, do things like sewing or knitting, and you couldn't before, you can do that with these on because they have the open finger design. Also, things like texting, working your phone is a lot easier as well. Interestingly enough, these also come in a variety of colors. They come in like gray and black, which is nothing extraordinary, but they also have like a maroon color. So yeah, there are a lot of choices out there instead of just, the regular dull gray ones that you see a lot or black. So yeah, but question, is this permanent relief, temporary relief? How do these things work? Well, you put them on usually like within 30 to an hour, when your hands get kind of warm, and the compression kind of squeezes on there, gets fluid out, you're usually doing a lot better. And when you take them off, a lot of times, you're back to where you were before. But these do allow you to do certain activities that you maybe couldn't otherwise without the gloves. But I think there is a way actually to get permanent or longer term relief using these gloves. But it'll take a multi-pronged treatment approach. It takes several things. Let's say the gloves help you while you have them on, but we know things like exercise. For instance, if you get your hands stronger and you get them more flexible, you're going to have less pain when you have arthritis. It's been proven in research studies. But you can't do any exercises right now because your hand hurts too much and your fingers are sore and they hurt. So what you do is you put these gloves on, then after about 30 minutes or an hour, your hands are feeling better, you're able to do more with it. Now you're able to do the exercises. So for instance, I'll use this as an example, Treat Your Own Hand and Thumb Osteoarthritis by Jim Johnson, PT. Basically, you can do things like range of motion exercises. Anytime you do like hand therapy or anything, or go to an occupational therapist to get hand exercises, they're always going to do range of motion exercises. And why is that? Well, one big reason is because the joints in your fingers and in your hand, they're synovial joints, and synovial joints have synovial fluid in there. Synovial fluid coats the ends of the joints and provides nutrition to the articular cartilage. But the problem is, if you don't, the synovial fluid, how does it get to all of the, all the whole surface of the joints? Well, that's with motion. So if you're only moving your fingers like partially and you're not taking them through a full range of motion, synovial fluid's not getting, it's not sloshed over the whole joint like it normally should. It's not getting dispersed as much, only partially. Or at least not as much as it should, because you're not moving through the full range of motion, so you're not spreading that synovial fluid around. So if you do range of motion exercise, you increase your range of motion, all parts of the articular cartilage get that synovial fluid, which is nutrition and just doing a whole lot better. So range of motion exercises are definitely a must, and they only take you a few minutes to do if you know which ones to do. Making your hands stronger, there's exercises you can do like with a light dumbbell that work all the finger muscles. Just take a couple minutes. This book's really interesting because it actually has an exercise for the base of your thumb. A lot of people get base of the thumb arthritis as they get older, especially females. And what happens is that joint there, it kind of becomes unstable, and so it starts to really stress the ligaments. In the later stages, the ligaments actually get shredded, and then you end up seeing people with deformities like this, their thumbs sticking out. That's because that whole joint is collapsed. So the whole thing actually has to do with stability. There's a muscle called your abductor pollicis longus. It actually attaches to that joint, and that can really provide a lot more stability to that joint and really beef that up. So this exercise you only do a couple times a week using like a rubber band. You strengthen that muscle, you get more joint stability as you use your joint, you keep everything in place where it's supposed to, and you have less pain. So there are things really you can do for hand arthritis. But maybe you couldn't do them until you had these gloves on. Put the gloves on, do your exercises, get that longer term relief. So yeah, these are good gloves, definitely check it out.